Okay, welcome, Asheena. And
Hello.
I think we're waiting for you to tell us all about reflexology right now.
Okay, sounds good. So I'm Asheena, and like Harriet said, I do have my business Reflexology by Asheena. If you've never experienced reflexology, it's kind of similar to acupuncture in a way where it kind of focuses on certain pressure points of the body to kind of stimulate your nervous system. I do specialize in foot reflexology, and soon I'll be able to offer hand reflexology as well. And like basically in layman's terms, when someone new comes to ask me what reflexology is, I pretty much tell them it's a really great foot massage and it's going to help treat your whole body at the same time.
I wonder how many people have had a reflexology treatment. Anyone? Yeah, I have. It's awesome.
Yeah, I love reflexology. So I guess a little background about myself was growing up, oh geez, I had a tough go in high school, and then in my early teens, you know what I mean, kind of hanging around with the wrong crowd, and that kind of pushed me to kind of really shift my life into my early 20s and kind of reassess and reevaluate my goals. And I really pushed towards more of an all natural approach in my life, and that's where I was kind of saying more no to like the medications and Advils and stuff like that to kind of heal my body, and more focusing on movement and other natural ways like acupuncture and cupping and Thai massage and all those kind of things, which led me to reflexology. So when I got pregnant at 26 with my son, he's 3 now, soon to be 4, I was probably in the best shape of my life, doing a lot of fitness stuff and martial arts, and boy, did that pregnancy play a toll on me. It ripped me apart, and I was in pain nonstop the last third trimester. I was pretty much bedridden. So I was kind of looking for a place or something that could help relieve some of the pain, because I'm sure all you ladies know you can't really take too much when you're pregnant. So I did resort to Tylenol a few times. It didn't really do too much. I was way too big to be laying on my back for a massage, and I couldn't lay on my stomach. So I found reflexology through an amazing lady here in town. And I got so much relief from that. So once I experienced that, I couldn't really do much anyways. So I started studying and went through the Ontario College of Reflexology to kind of learn. And then pretty much it all kind of unfolded from there. And we're pushing us to here we are today. So I'll kind of show you guys this a little bit just to kind of give you guys a visual. If I can do this. All right. Uh-oh. It's not letting me screen share here. 1 second.
Okay, let's see if that works. Oops, I don't want me. Okay.
Okay, let's see here.
Your co-host, Asheena, you should be able to share.
Yeah. What is going on here? Sorry, ladies.
Okay.
I'll keep figuring this out. But well, with the reflexology, so I did open a place down in downtown. I started there with another lady who does another holistic practice, and she does Thai massage. And she's a lovely lady.
She was on yesterday, Asheena.
Oh yeah, okay. So started there and kind of built up a client base and started expanding a little bit. I got trained into Indian head massage, so that's really great. That's a massage of the scalp, the neck, the face, the shoulders. I'm just finishing up my certification for Thai massage. I also just got certified as a nail technician. And soon, once I finish my exam and a bunch of practicals, I should have my hand reflexology certification. So it's kind of an all-in-one place where you can come for massage. And right now I'm at 955 Stockdale Road since I recently moved. It used to be Secret Waxing. So a lady used to work there. She worked there for many years and left. So we renovated that spot and now we're working out of there. And so reflexology is my passion. As much as I offer these other services, I really try and focus on the reflexology. I have a lot of clients who, cancer treatment patients, either who have been through chemo and have fought cancer, who are currently in remission or are still doing their treatment. And it's a really great way to help with the pain relief as they're going through that and kind of help de-stress their nervous system and relax their body, because it's a stressful time for anybody trying to go through something like that. So I really like to focus on that aspect of it. A lot of people come for reflexology if they're having sleep issues or gut issues. That's a common one as well. And you know what? Some people just come because they want a foot massage. They just like getting their feet rubbed. They don't have to ask their partner, and they'll come see me instead. So, and yeah, I'm sorry, Harriet, for some reason, my system preferences won't let me.
We had the same problem yesterday, but I'm checking my screen share and there shouldn't be an issue. So it says one participant can share at a time, unless somebody has their screen share on, but I would know that pretty quickly. Let me try something else and see if that works. Can you try now?
Okay, 1 second here. All right, let's see if this will work. 1 second here. I don't think it'll let me change it while I'm in here.
Yeah, I'm gonna check here. I'm gonna, I don't know if I can do this, but no, it won't work. Oh, something happened there. I don't know what that was.
I think I have to change my system preferences on my laptop here, and it won't let me do it while I'm in the actual Zoom meeting.
Okay,
So I apologize for that.
no worries.
Mm.
Can you send me can you send it to me and I do that? You can continue to talk to
Yeah,
present, and I'll see if I can get it up for you.
for sure. No worries. Yeah. So it's just a PowerPoint slide for you, Harriet.
Okay.
So with reflexology, so the basis behind it is when you're doing reflexology, the way we learn it is we really focus on the nervous system. So there's two sides to the nervous system. There's the sympathetic side, which is your fight or flight mode. And then there's your parasympathetic side, which is your relax, rest, and digest side of the nervous system. So when people say that stress kills, what their basic concept behind that is that our body is in the sympathetic nervous system side way too much of our time. So when we're in that sympathetic nervous system mode of our bodies, it's pumping adrenaline to our body and it's shutting off basic functions like digestion and other functions like that to kind of focus on the blood flow and the heart rate and other systems to kind of, it's basically trying to save our lives because we're too stressed out. So if you get really scared when people say, are you fight or flight, it's whether you're going to fight or if you're going to run. Either way, you're in that mode where your body's panicking, trying to save itself. So when you're in that mode for too long and shutting off your digestion and other body functions that are just natural to us, it plays a toll on our body and it kind of hurts us. And that's what kills, because then that can later cause serious health issues. So when we do reflexology or massage or Thai massage, or we get chiropractic care, the best thing about this is we're switching our nervous system to go into the parasympathetic side. So what that means is we're starting to rest. Our body is in a mode where we're relaxed, we're digesting, we're healing, we're sending white blood cells all over where our body needs it if we're injured and whatnot. So that's kind of what we really want to focus on. So when I say reflexology helps to treat sleep issues or gut issues or pain relief, or decrease inflammation. It's because we're putting our body in a state of healing by switching that. So our whole point is we want to balance both of those systems, the sympathetic and the parasympathetic, because we obviously both need those systems in our life to function properly. We want to balance those evenly, and that's where the homeostasis comes. So our body's working full circle, all our functions are running properly, and we're in our best capability to heal and function in life. So when people come to me, I always try and give them a good full relaxation. The space is a safe space. I usually do only by appointment only. I find a lot of people that come to me usually have high anxiety as well, or maybe possibly depression. Those are some of the ailments they'll come to see me for, to have reflexology treat. So by creating that safe place, it allows them to relax. So by appointment only, there's no one else in the building. They just come in with me. We go into the room. We do some deep breathing before every session. Breathing is a great way as well to bring your body back into that parasympathetic state. And then we go along with your session. And basically, you don't have to get undressed for any of this. You get to keep your clothes on. We soak your feet, of course, just to get any dirt or grind off of it. And then we go along with the session, and you only have to remove your socks. So with the space I'm in now, I was able to kind of get out of a basement of a building. So this is really great. So now I can see people who have mobility issues, people in wheelchairs. Everyone can come see me now. So that's really great. I have a couple people with leg braces and ankle braces that mobility was an issue with the stairs at the last location. So that's been really fun and grateful to see and be able to see those people now. And it's just a foot massage, really. So we have really great techniques that we learn as reflexology. Some is called thumb walking. So if you'll see, it's almost like flicking your thumb, if you can almost see that. And that's mostly the main technique that we use. We also use common other just relaxation massage techniques that you would see a massage therapist use, or a Thai massage or a relaxation masseuse use as well. And it releases, improves circulation in your ankles and your feet. So in turn, it'll relieve some inflammation and swelling that you might have in your feet and ankles. And the common thing I see is a lot of people don't treat their feet. We're on them all day long. We usually don't treat them unless they hurt, but we don't notice the fact that oftentimes our ankles and our feet take a toll, and wrong shoes and no orthotics, people with bunions, people who have had foot surgeries like bunionectomies and stuff like that, toenail removals, all that stuff, reflexology can treat that after. Yeah, so other than that, for the reflexology side of it, like I said, I will be moving into hand reflexology, which is another form of reflexology. And it's just the same concept as the feet, except we're doing it onto your hands and wrists and forearms. And we have a reflexology map. So in the basis of our learning, if you look at the feet and hands, there's going to be a part of that whole system where your nervous system is going to end. So we say that if this is your diaphragm line in your hand, we're going to say that by working that area, we're going to stimulate that nerve. In turn, whichever nerve that is touching in the rest of your body, it's going to stimulate that nerve as well, and kind of get that firing and push you into the parasympathetic side, so it'll start working.
We have a couple of questions.
Yeah, sure.
Or comments. Reflexology treatment, in a treatment, do you just do foot and ankle? This is Roseanne, when she had a treatment, it included the calf as well.
Yeah, so we do some calf work. It goes up the side of the ankle on both sides. And I do some massage techniques of the actual calf muscle, because that usually gets really tense, especially if we have foot ailments, or if we flex our feet in a certain way or whatnot. So I do add those massage techniques to the feet and ankles as well. Also, since I do Indian head massage, especially with people with anxiety, when you meet someone new and you go try something new, it's always a little nerve-wracking, and it takes us a little bit longer to kind of relax in a new setting. So I'd offer an Indian head massage first, just for like 15 minutes. And so we're relaxing the scalp and the neck muscles. We're massaging the shoulders and in behind the back. We're going to stimulate all your hair follicles by doing some hair plucking, which is some gentle pulling, some massaging of the scalp, just to kind of get the body relaxed, and then move into your reflexology session to finish.
I'm almost feeling that right now.
Yeah, it's the best. If you just want to have someone play with your hair for 15 minutes, 30 minutes, that's
oh my God.
Yeah.
I've had an Indian head massage. It's just, it's heaven. It's
Yes.
heaven. But I've also had reflexology. Can you do reflexology on yourself? I'm just curious. And maybe it'll be a chance for us to try something on ourselves. Can we do that? Just to get an idea of how it works.
Yeah. So
on our hands anyways.
The hand reflexology, like I said, I'm not certified yet. So I'll do something. So a good thing for digestion or indigestion, a good technique, you take both of your fists like this, you cross them over, and you're going to do a circular rubbing motion on the back of your hand. So if you get like that, just cross your hands and you're going to rub, 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 rub. Do that 2 or 3 times for about 10, 20 seconds each, a couple times a day. And that's going to help with the acupressure points to aid in digestion. And it helped with weight loss too, but it's just because we're kind of stimulating some of your enzymes, secretion and whatnot by going like this.
Really?
So that's one.
Wow.
Another one is your solar plexus. So your solar plexus is just your big ball of nerves, and it's right in between your chest area, in between your lungs. So that area is right in the center in the ball. So if you go down your middle finger, you're going to circle all the way down right before it starts to divot in your palm, right in there. And you're going to press in there and you're going to hold it for a couple seconds, and then you can release. And then you can do that a couple times. And that's going to help with anxiety and stress.
Oh.
Another good one for this is more of
you do it on both sides or just one?
Yeah, both sides. So also basis of reflexology is the left side of the body mirrors the left side, and the right side mirrors the right side of the body.
Asheena, can I ask a question? It's Patty Graham asking.
Yeah, of course.
Quite often what I do for myself, and I find myself doing it when I'm at an intersection and it's a red light, and I'm in my vehicle, is that I squeeze between my pointer finger and my thumb, that area in there. And I do that and I really enjoy it. But I can't remember why I do it. It was years ago that I was taught to do that. And now I don't know, my short-term memories or my long-term memories getting bad. I still do it, but it occurs to me now, why do I do it? Can you help me there? What does that help?
Yeah, for sure. So this is an acupressure point. So what this is going to do is this is going to help stimulate a bunch of nerves, and this is going to aid. So even if you have really bad headaches or migraines, this is a really great point to stimulate. And you just take your hand and you're going to take your 2 fingers and either side, go in there, and you're just going to squeeze and hold. And it'll probably feel really nice. It's a really meaty, muscly part of your hand. So that's a really good acupressure point for stress as well. So it's going to treat some of the brain reflexes, and it's going to help with some of your stress hormones right in there.
Thank you. I appreciate that. And it just, I do it now just because it feels so darn good. And I I had forgotten really what had initiated that after a reflexology session years ago, but I still do it. So I can attest to that.
That's amazing.
Thank you.
Well, reflexology has been around for a really, really long time. And you want to know something? The first time I ever really heard about it was from my father-in-law, and he was in his 70s, and he got it way back. His doctor recommended it way back in the 60s or the 70s. And it's a treatment that's been around a long time that I don't think it gets enough credit for. And, Reflexology Association of Canada right now is working really hard to kind of make one governing body so we can get more insurance coverage. As of right now, you can get reflexology and get it covered under your insurance benefits through Manulife, through Green Shield, and through SSQ. Those are the 3 main insurance companies that will cover it. There are other insurance companies that will cover your reflexology session, like an RMT massage. but it would have to be done by an actual osteopath who's trained as a reflexologist as well. So just if you're thinking, maybe if you ever want to get a treatment and wanted benefits from that, just kind of maybe even call your insurance provider for that. So hopefully in the future with the association, it'll be more umbrellaed under one company and everyone will be certified as an RCRT, a reflex registered Canadian reflexology therapist. Sorry. So that is the designation. They're trying to make all reflexologists come under one governing body. So that way it's more cohesive, and we'll have a governing body like the nursing profession and as well as massage therapy.
Yeah, a health professional.
Yes. Yeah.
Okay.
So that's working towards that. So that's really great. Another thing too, if you can reach your feet or if it's not too tough for you, I know reaching down your feet kind of sucks, but if you can reach your feet or maybe cross your legs, the point of, I should have my little foot. I do have a little plastic foot named Tony that I usually do demonstrations on for people. It's at work today. So I'm going to be really awkward right now and I'll show you a little bit. So if you look on the side of your foot, right on the inside or the medial side of your foot, right along the inside, this is your spine reflex. So this is right up here by your toes is your cervical spine. We're getting into your thoracic spine, right in between your shoulders, right in here. We move down into your lumbar spine, right into the instep part. And then right on the bottom is getting into your sacrum and your coccyx or your tailbone. So if you massage that area with the sore back, it's really good to stimulate it. Or even if you notice if you have a foot bath or a foot roller, a massage ball, you can always step on that and move your foot around in those areas, just to help relieve some pain and kind of fire off some of those nerves to get you going.
Now, I remember having a reflexology treatment, and I was told that there is an area in here somewhere that is actually your arousal area.
Yes, there is. It's no lie, but
not that I want to get aroused right now, but anyway, yeah, that's true.
Yeah, so if you look in your inside of your foot, so right in there, right in the bottom of your foot, out please, right in this little section right here, this is going to be some of your reproductive organs, and then same with on the side as well of your foot and your ankle. So when I say the side of the foot and ankle, right up in here, we're getting into your vagina, prostate area, and moving up that way. So definitely great things. That's the great thing about reflexology is you can treat the whole body in any area, kind of just from stimulating your hands and your feet.
Where are the lungs?
The lungs. So if you want to treat your lungs, so right on your palm, it's going to be right in here, right that meaty flesh, right above this line. So right underneath your fingers. And then on the toes, it's going to be right underneath your toes, this meaty, the pad underneath your toes. That's your lungs area. And then if you look on the top of your foot, on the dorsal area, it's going to be right there, that square area. That's going to be your lungs, and your thoracic area as well.
So when you're doing a treatment, Asheena, do you, you can tell, well, I'm sure a lot of mature women like ourselves will have some arthritis or some things going on in their feet. And so you can recognize that, eh? Yeah.
So as a reflexologist, we kind of learned that you can feel what we call deposits in the feet. And then when we feel that, which almost feels like popping or grittiness under the skin, like almost like a little tiny bubble pop. You'll feel it right. And massage therapists will say, oh, you got knots here. That's kind of what we kind of relate it to is we'll find knots in areas of your feet or your hands. And that'll give us an indication that that area of your body, maybe there's some blockages or I need some healing or some injury, stuff like that. And we'll work those areas. We'll be mindful as we find these areas and we'll work over those areas to try and clear that until we don't feel that anymore.
Okay. So when you're, when you asked us to do this with our hand, like one hand there's nothing there. It's just nice and smooth, but the other side feels harder.
Yeah,
Does that happen?
it does. It does. I try not to look into that too much, only because on that basis, we always have a dominant side of our body. So that's, in my personal opinion, because I do like the scientific part of it, is I feel like that's getting more into like the actual muscle tissue and the denseness of it and how strong it is. So like if I'm treating someone's right foot compared to their left foot, they might use that foot, put it in a weird, so the muscles and the fascia is going to be a little bit more tense and tight than the other side of the foot. With that topic, a lot of people come to see me for plantar fasciitis. So that's a really good treatment. Reflexology is a really great treatment for that, because what we're doing is we're kind of separating that muscle tissue as we go through the reflexology. Meridian lines and whatnot as we work through the feet, and it's going to separate all that muscle tissue and give some people some good relief.
Wonderful.
Asheena,
Yeah.
I'm just wondering, do you treat problems with metatarsal as well?
So this is when anyone comes in for a reflexology session, they do an extensive medical form just to make sure there's no medical issues, make sure some medications aren't going to affect with it. If you're diabetic, I try to refrain from treating people with diabetes depending on what stage of diabetes they have, just because it could cause some injury. They have less feeling as well, so the pressure could really affect them. So I always make sure if anyone has any broken bones, any prosthesis, or anything like that, we really have to talk about that first before we go through. So with your metatarsals and stuff, we do a lot of thumb walking through there. We do a lot of toe rotations. So if it's anything's broken and whatnot, I'll kind of refrain from that area. And like I've done before, someone who has like an injury or plates in a toe or whatnot, I'll just avoid that area and I'll work the rest of the body around it. And I can do gentle sweeping and massage techniques on that area according to their pain level.
Thank you.
I have a question, Athena.
Yeah.
How do you, hi Asheena, it's
Hi.
Debbie.
Hi, Debbie.
How do you treat people that have very, very ticklish feet? How do you get them to relax?
You know, I get that a lot because a lot of people don't want to come see me because they're like, no, way too ticklish for that. And you'd be surprised. So I've had a few people that I'm trying to get some good testimonials out of them so I can share this information with. So it's not a tickling touch. So reflexology is really a pressure. And with the techniques I use, it's instead of gliding over, we're going to grab it and squeeze more so instead. So I know a lot of people are worried about thinking it's going to be ticklish, and then they come and they're really surprised because it's not. So obviously, if you are, I guess, crazy ticklish and it didn't work out, we can always, we'll move on. We'll do something else. I'll give you an Indian head massage or something else instead. But I've never had that situation before. So they usually end up really surprised because it's a pressure technique, and we're really stimulating certain areas and pushing in and pushing pressure on certain acupressure points. The ticklish feeling never really is an issue for most people.
Do you use creams at all, or Asheena, or?
Yes, I do use cream. I have some people who really like a lot of pressure. So if someone wants like more pressure, I won't use any cream because I can get more friction and whatnot without using any oil or cream. I do make my own oils for foot massage. So it's all natural and it has a lot of health benefits. Like I'll use some hemp seed oil, which is really good for some inflammation and stuff. There's jojoba oil in there, olive oil, which is also antibacterial, castor oil, and I use that kind of mixture out, please, to use on for people's feet. Also, but I do scent my oils with essential oils. So if people don't like that, I'll always go back to either just a coconut oil. If they have a peanut allergy or whatnot, we just stick with an olive oil or nothing at all. So it really depends on what the person's preference is. But yes, I usually prefer to use an oil or some kind of lubricant while doing reflexology.
So if you have a new client, let's just say I'm going to come and see you, do you send the form ahead of time, or do you do that when you fill out the form when you go in?
I do. I fill it out when people come in, only because I tried it before sending it out ahead of time, but then we kind of forget. And when someone's filling it out and I'm asking them questions at the same time, usually they'll think of some things in the moment that maybe they forgot or they missed before. So I always like, so even if someone fills out a form, I'll still ask them more questions, because they'll think a little more and they're like, oh yeah, actually I do. And so I usually always do it at the beginning of session.
Okay. So you have a 30-minute and a 60-minute session?
Yes. So the 30-minute session is like a mini session. We kind of hit all the basics of reflexology, but I don't get to do a full session. So there's certain parts of the body that I would miss in that session. But it's still great for someone who just wants to come in for a quick relief or fresh up, or if they've been doing reflexology for a long time, they're just kind of maintaining health at this point. And then a 45 to 60-minute session. The full reflexology session is 45 minutes. I say it's 45 to 60 minutes because on the topic of deposits, if I find areas in the feet, or if someone came in and was like, oh man, my hip's really hurting today, we'll do the full session and then we'll go back over those certain areas that they wanted to work on. So I'll specifically treat just those areas at the end after going through the full 45-minute session, which could bring us to 60 minutes.
Okay, so I guess we should talk about pricing, that people probably want to know a little bit about that.
Yeah, so I like to think of myself as pretty reasonable. 30 minutes is $30 and then 45 minutes is $45. If you want to add on a 15-minute head massage with that, then your price comes up to 60 minutes. Also, people have the option to do a 30-minute Indian head massage, working their back, shoulders a little bit more, their neck, and then doing a 30-minute reflexology session. That's also $60. So that's my price point. I'm hoping to try and keep it at that price point as long as I can, because I think it's a really good price, and anything higher than that, I'd be struggling to charge people that, but with inflation these days, who knows what the future is going to hold for us, but
That's pretty reasonable, I would say.
yeah. So
Any
I
other
see that price point.
Any other questions? Can you send me that information, Asheena, so that, or send me, is that on your PowerPoint?
I can add a slide for pricing on there for sure. Yeah, no problem.
Okay.
And then I'll send that over to you.
I was hoping you'd do it right now because then I could show it to everybody, but that's okay.
Via email?
Yeah, sure. I don't know if it'll go in an email, I might have to go to mail drop. Carolyn has a comment here. I had a foot reflexology session and a hand reflexology session set up, but the person doing the session stated that both benefited the same thing. Which makes you choose?
I said,
Which
I'm
one?
thinking of how would you choose whether, once you're qualified to do the hand reflexology, so how would you choose whether to do a foot reflexology or a hand reflexology?
So it all depends on the person. Some people really want the foot massage techniques in there, so we would do the foot reflexology. The hand reflexology is great. So with the nail technician certification that I just got, I'd be able to do a hand reflexology session, do some massage techniques, and then maybe finish with a polish. So that would be more of like a spa treatment that way. If someone has mobility issues or is wheelchair bound or maybe paralyzed from the waist down, I can still treat the body by using the hands because they obviously wouldn't have feeling in their feet. There's a bunch of people too that would come to see me who has neuropathy. And that's usually a symptom from their cancer treatment and whatnot. So now they're suffering from that. So because of the limited feeling in their feet, they don't really enjoy it as much as I'm still doing the techniques. They can't feel it as much. So I would opt into maybe do a hand reflexology session where they have a little bit more feeling and would get the most benefit from the session.
Thank you. That makes sense.
Okay. Questions? Okay. Seeing none, I look forward to getting that PowerPoint, Asheena, from you.
Yeah, for sure.
I'll pass the information in an email on to everyone.
Thank you so much.
listen, Asheena's, I'm going to tell you this, going to come on to Earth in a Nest pretty soon. And so she'll be part of our, that you'll be number 60 if you do that today.
Oh, I love even numbers.
Yeah, thank you so much, Asheena. That's a very thorough description of reflexology. And I think I can pass that on information on to the membership for sure.
Awesome. Thank
And
you so much.
thank
for
you.
having me.
Thank you so
I
much.
really appreciate it. This was a lot of fun, and thanks everybody for the questions and feedback. I really appreciate it.
And you're on Stockdale?
Yes,
Is there-
955 Stockdale Road. It says Unit 3, but we're a little hidden right now. We're kind of incognito because we're still waiting for Gateway Signs to come finish our signage on the front of the building. So there's no signs for us right now. So it's a little
Okay.
sad, but hopefully we have that done up in a couple months.
Are you
Okay.
in the bottom of one of the larger buildings then, or are you over by the bingo hall?
No, yeah, in the bottom of the large building. So there's lavender and lacquer down there. There's the stone place that does headstones. There's the chiropractor office. I'm right beside that, and it's kind of across the street from Airport Animal Hospital, right on that corner there, behind both of the RBC buildings.
Okay. Wonderful. Thanks so much, Asheena.
Thank you.
Yes, from all of us.
Thank you so much. Have a great day, everybody.